I decided to put out this video on the COVID-19 epidemic because I've been getting phone calls and emails asking me about the workers' compensation options for those who have gotten sick or may get sick. For the most part, I think it's one of those things that is going to be very difficult from a workers' compensation perspective to prove that you obtained the virus through work, though obviously it's going to be fact by fact basis, and those who are in the healthcare industry are going to have potentially a presumption, maybe not a legal presumption, but one that can be argued, a presumption that the illness occurred at work. That is the first threshold in which we have to analyze whether getting the virus is even work-related before we can get to whether there are any benefits that would come from the illness. Hopefully it's one of those situations for you in which the illness passes quickly, and maybe you'll have some time missed from work. The question then becomes, are you missing work because work has been shut down, we've been told to stay home, or is it because you're unable to work because of the illness? Benefits can be obtained, and there's a lot of information online, and I'm going to put on our website some information that was provided by the state of California to provide benefits during this period of time that we're staying home. And it will depend on if you're staying home because you've been let go. Benefits will be determined based upon whether you are a full-time employee, part-time employee, and those benefits are in flux as we speak. But I'll be posting some information on my website and some links so that you can access unemployment disability, state disability insurance, look at some information about paid sick leave, paid family leave. Now, while that's outside of the workers' compensation specialty, and I cannot advise on those things, I think the information would be helpful, and there's other information online to seek benefits. Another potential aspect of the claim for healthcare workers could be psychological in nature. Now, we're hearing stories of healthcare workers going to work, being overwhelmed by the numbers of people coming through, not having the protections that they need to do their job and to stay safe themselves. And obviously, this is kind of outside the standard stressors that a healthcare worker is going through on a day-to-day basis. And I think that we're going to see healthcare workers, at least now, they're doing their jobs and they're fighting through it. And it's been painful to see some of them, online and going to the newspapers with how bad it is at the locations that they're working at. But when they get through this and we get to the other side, or even during this epidemic, I think we're going to see some psychological claims that come from it. And again, the thresholds will have to be met, not only in regards to it being work-related, but other thresholds that were instituted after 2013 dates of injury. And again, I think we'll probably see more of those types of claims than potential physical, permanent physical harm due to the coronavirus itself. Now, God forbid that the virus leads to a death for someone you know, then again, analyzing the benefits through the work comp system would first determine whether it's work-related, being able to prove or at least having a doctor say within reasonable medical probability that the virus was contracted in a work environment before getting to whether there's potential death benefits. If you have further questions and want to contact our office, please do so.